global organizations, including the World Health Organization and the UN, are backing targets to end AIDS as a public health threat by 2030. In Ghana, a self-test HIV kit is helping people to find out their status in privacy without having to visit a doctor. Stigma and logistical challenges can hamper testing efforts, but critics say this method will affect the quality of data gathering.
Rejoice, not her real name, is very happy about the HIV self-test kit. She works in a mobile phone store by day and as a sex worker at night. In the past, she would have gone to the hospital to get tested for HIV, but she can now test from home.
It has made it easy. One, the stress of going there. Two, the inconveniences when you get to the hospital and running of tests to sit and wait and all that. So it relieves me. If this one can just be done and come out now, I think it's easy.
Ghana is battling with a steady rise of HIV/AIDS infections. In the first half of 2022 alone, nearly 24,000 people tested positive for the virus, according to the Ghana AIDS Commission. Research shows that up to 30% of infected people are unaware of their status before being tested. One reason why this self-test kit could be a game changer. Sex workers are among the highest risk groups in Ghana. Over the years, the country set up testing centers in hospitals for people to walk in and test. But many were too embarrassed or simply too afraid of being seen to do so. Ghana is now pinning its hopes on the new kit to get people to test.
If they had to come to the hospital, they have to meet the nurses. They have to screen them. They have to take the information before they get to the lab. But then they screen at home. The fellow is negative. The fellow will never bother to come here. It's only the positive cases or the reactive cases that would come here.
While HIV infections have decreased overall in Ghana, the rate of adult infections and deaths linked to HIV/AIDS has remained stubbornly high over the past 2 decades. The focus has been on sexual intercourse as the main source of transmission, but needle sharing and poor sterilization practices have also contributed to the higher adult infection rates.
It is skewed towards those maybe commercial sex workers where we're thinking of sex, forgetting that there are other shafts that one can engage in or one can get it through.
No matter how the virus is transmitted, the kit will make it easier for everyone to test. For Rejoice, the procedure is simplicity itself. She just has to swab her gums and then place the swab into a tube of liquid. In 20 minutes, she has a result. If the test shows a single line, it means no infection, but 2 lines means there is an infection.
Wow, I am negative.
Rejoice hopes to leave the sex business soon, but until then, this kit will mean she can monitor her health anytime she wants.